Welcome to Rare Connection, the podcast dedicated to bridging the gap between rare disease patients, medical professionals, and the public. I'm your host, Joanna, and my mission is to shine a light on the 95% of rare conditions that lack FDA-approved treatments, while helping patients find community and resources. Today, I'm joined by Mimi, a woman whose journey with Sjogren's syndrome took nearly 20 years to be recognized by doctors. Often dismissed as just a dry eye disorder, Sjogren's can have serious systematic effects, including lung complications. Mimi's diagnosis came only after experiencing respiratory failure, which led to pulmonary fibrosis and the need for nightly oxygen. Beyond her medical journey, Mimi is an author and advocate of 33 years, with 33 years sobriety, dedicated to resilience and the empowerment. She has written several books, including The Anatomy of an Allien, which explores her medical challenges, and Raised by Wolves, Trapped by Demons, a memoir about overcoming child abuse. Her story is one of strength, survival, and advocacy, and I'm honored to share with you today. Before we begin, I want to a quick reminder. The information shared in this podcast is for awareness and discussion purposes only. It is not a substitute for professional medical advice. If you have any questions about your health, please consult a qualified medical healthcare provider. Now let's dive in. Mimi, can you talk about? Mimi, can you take us back to the early symptoms of you experienced? What was happening with your body?
Yeah. Okay. So I had many careers. Okay. And one of them was in the hospitality area. I owned 2 bars and I bartended for many years. And the other one was actually working with people with disabilities. And when I was doing that job, I was on the road a lot. And I started to experience brain fog. And brain fog is just, it's not like forgetting things. It's just like being very confused. And the one day I got lost coming back from a client. And I thought, oh my, what's going on here? And then a couple weeks later, I had a client who was had MS, was in a wheelchair, could not speak, was quadriplegic, and I took her to an event. And after the event, I was halfway home and realized I had left her there. It's funny now. So I turned around and went back and got her, and I knew that there was something going on with my brain. And I had to resign that job. And after that, we still had the business. We owned a bar and a hotel. And I continued to try to work. And I started having all kinds of aches and pains in my body. And I went to a neurologist, and I went to a rheumatologist. And the consensus was fibromyalgia. Now, we're talking about probably 1990, around then. And I think when they could not diagnose what was going on with you, they had this umbrella fibromyalgia that they would put everything under. I went to another rheumatologist because I was also getting very tired, very fatigued, and not the usual tired, the fatigue where you absolutely cannot move out of the chair. You cannot. And she told me there were certain spots in the body that would tell if it was fibromyalgia. She said there were 10 places that she was going to press on. And if I had 3 or more, then I did have fibromyalgia. Well, all of them hurt, all 10. So I stayed with that fibromyalgia diagnosis for a long time. So that kind of answers that question. What would you like me to continue about what I did to on my own to try to fix the problem? Okay. So I had 2 abusive marriages to very toxic men, and I had an alcoholic father. So the first 40 years of my life, there was a lot of violence and abuse. And I think anyone would end up with some sort of post-traumatic stress disorder from what I went through. And, there's a book called The Body Keeps the Score. And it's so true. All these things that are happening to you outside of your body affects the inside of your body. And that theory has been well documented. So I did not know what was going on. I could not find an answer. And I did own a bar. And I found out that if I had a couple drinks, I was relaxed. I didn't hurt as much. However, not knowing that I had a major depressive disorder, which had not been diagnosed, I drank more and more and became an alcoholic. Okay. I was self-medicating. That's what I was doing. I know that now. Did not know that then. And the self-medicating of alcohol did help with the pain, and it did help with anxiety. So that did work for a while. Yeah. I had an accident. I wasn't driving. My husband was driving, but it was a bad accident. And it was in the winter, and it was one of those domino type things, like once one car hits a car, they just keep going. And my husband pulled over to the side and got out of the car, and I was in the car, and the truck hit our car. And it's amazing that I'm alive. But from that, I was looked over to make sure that there was nothing else. And I had some back issues and neck pain. So of course I went to a orthopedic doctor, and he put me on pain pills and muscle relaxers. And anybody that's ever taking those medicines has seen on the bottle, it says, do not take with alcohol. Now, at the time, I'm an active alcoholic. I don't think I'm an alcoholic, but I am. And I decided they didn't mean me. They mean people that don't normally drink. So I ignored the instructions. And because of that, I started to have blackouts. Now, I'm not feeling pain anymore. I'm numb. I'm pretty much numb. And what happened is I started having blackouts, and I did not like that. I did not like the next day having people tell me I said or did something that I did not remember, because I'm a very controlling person because of my childhood and traumatic marriages. I needed to be in control because that was from the PTSD. So, because of that, I was scared. And I went into a rehab and I got sober, and they had to medically detox me because of how much stuff was in my body. And after 28 days, the psychiatrist told me, you have major depressive disorder and panic disorder, and you do need to be on medication, but not alcohol and not the pills you were taking. So that happened. Then the pain came back, of course, and it was mostly achy pain, and the fatigue came back, and my back hurt. And we ended up moving to Florida, and that's where the things really started happening. The pain was bad, the fatigue was bad. I tried acupuncture, Reiki, yoga, massage, meditation, mindfulness. I could go on and on. But nothing really helped. So finally, other things started to happen. I had always had low self-esteem, and that's only normal considering my upbringing. I had a cold mother that did not give me attention, and an alcoholic father. So, of course, I was broken, basically. And the things I tried in my life, which was alcohol and men, did not fix anything. So I had to find a way to feel better about myself. And I was overweight. And at the time, they were doing what was called a lap band surgery to lose weight. And it was considered the safest thing you could do. Okay. And I thought, well, I think I'm going to do that. And it sounds okay. It sounds good. And I went to what I thought was a very good hospital. I had the surgery. Everything seemed to go well. And after a couple days, I spiked a fever of like 104. And I went back into the hospital, and they told me I must have an infection from the surgery. So what began then was a horror show, because I ended up being in that hospital for the whole summer. And they did endoscopies, colonoscopies, and they said that my stomach was unbelievably formed in unusual ways. It wasn't formed like a normal stomach. It had fistulas, which are openings. It had dead ends where food had gone in and got stuck there. That I could have had food there from 10 years ago. So they made me worse. They did a test on my lungs. They wanted to look at my lungs, and the doctor doing the test punctured my lung and didn't even realize he punctured my lung. I'm taken back to my room, and I'm telling the nurse, I can't breathe. I can't breathe. They take me back down. He had punctured my lung. So it just was horrible, Joanne. It was an awful time with that. I left there. I was on IV nutrition. I could not even have water because they were constantly doing tests and then surgeries to fix fistulas and rearrange my stomach and everything else. And when I would get discharged, within 2 days, my fever would spike and I'd end up back in the hospital. So they finally discharged me. I thought I was okay. Yes, I lost weight. That part worked. Not the way you would want to. And after a couple weeks, I started to throw up. I could not eat anything. And I said, oh my. So I went to my primary and he sent me to a gastroenterologist who looked at my records from this hospital, which were quite extensive. In fact, I sent you them, of all the things they did. And he said, you know, I'm not the right doctor for you. You don't hear that too often. He said, I am going to send you to someone that does do bariatric surgery, but I'm not sending you for that, of course, because it's already been done. But he also fixes the mistakes that happen. Right? Yeah. But you've had, yes, and it was supposed to be a safe way to have it, but it was the infection that I got. And the infection, of course, then led to them discovering the malformations in my stomach that would never have been found otherwise. So that was, I guess, a good thing. When I went to see this expert, Dr. Siwitz, he said, he heard the story and then he said, come here, stand behind this x-ray machine. My husband was standing next to the doctor. He said, and I could see, and he said, drink this water. So I took the water and I drank it, and you could see it squirt out the side of my stomach. Instead of going down the natural way with your GI system out, there was a hole and it squirted out the side. He said, you are going to have a full colonoscopy and endoscopy and the works tomorrow. And I don't do just a normal one. I go sideways, up, down, everywhere. Okay. I said, okay. You know, I was getting a little scared. So the next day he did that. And then in 2 days, I came in for the results. And he said, well, I have good news and bad news. And he said, the bad news is that your stomach is not functional. It's not functional. And the good, I said, well, is that the bad news? The good news? Well, the good news is I can fix it, but I have to remove 85% of your stomach. 85%. That meant my stomach would be the size of an egg. I wouldn't have to worry about gaining weight anymore. He told me also if I had waited another week, I would be dead. That's how bad it was. So what could I say? Of course I said yes. I had no choice. And he was wonderful. He did the surgery within days, removed 85% of my stomach. I was in a lot of pain. I was in the hospital for a couple of weeks while I healed. And I came home from that. And then it took weeks to be able to even get out of a chair. Because, when you have surgery on that part of your body, that's your core. That's where you need to be strong. Do you agree?
Yeah.
Yeah. Yeah. Just to get up out of a chair. So that was hard. So I had a family member come down and help us out, which was great. And the next thing would be I had to learn how to eat properly, and my sense of taste had changed. Like I would say, I'd like some watermelon, and they'd get me watermelon. And then I'd take a bite and I'd say, oh, this tastes terrible. I mean, there were only a few things that tasted right. One of them was soft boiled eggs. I would have a soft boiled egg every day. That seemed to work fine. I recovered. I recovered from that, and I thought about getting a lawyer, but they told me in Florida, especially South Florida, there's no way a lawyer represents any medical cases against doctors. They just won't do it. It would be a waste of my time. So that's one thing. Next, I have had glasses since I was a child. And when they came out with, it blinked out there for a minute. Help me out, Joanna. The lenses, the contact lenses. I was so happy about that. But when they first came out with contact lenses, they were hard material and it was impossible to wear them. Then finally they came out with the soft lenses. That was wonderful. I no longer needed glasses. I was very happy. But now at this juncture in my life, I started to have very dry eyes. And I also was diagnosed with glaucoma and cataracts. I know. I've spent so much time in the doctor's office. It's not even funny. So what we did was have the cataracts removed. And the good news is if you have cataracts and you remove them, they're putting in a new lens. So all of a sudden you have 20/20 vision. All right. And I was like 60 years old and I had never had 20/20 vision. So I was very happy about that. And they also gave me what they asked if I wanted, monovision, which meant one eye would be for reading and one would be for long view, like driving or watching TV. I had no problem with that. I know some people have had that done and they said they were dizzy or whatever, but I was fine. I was fine with that. That was great. And then the doctor, the eye doctor, treated the glaucoma with medication, and it took a while for the pressure to go down. And glaucoma is very dangerous. It isn't treated. So we worked on that. Now, I was very happy with the eyes and everything. And then all of a sudden, they were getting so dry, very dry. And my throat was getting very dry. And he said, that's called sicca, and it's a lack of moisture. Your body is not making enough moisture for my eyes and my saliva. So I had now to investigate that because, Joanne, by this time, I did not really trust doctors or their opinions or their so-called knowledge. So I had to become my own advocate, so to speak. And I started to do the research, and I found a condition called Sjogren's syndrome. And Sjogren's syndrome is something that a lot of doctors don't even know what it is. And I finally found someone, a rheumatologist, that knew what it was. But he wanted to find a blood marker to prove that I had that, okay? And Sjogren's is very tricky to diagnose, okay? They can find blood markers for a lot of diseases, MS, lupus, things like that. And they say, oh, you have the marker. They would say, oh, you don't have the marker, so you don't have Sjogren's. I didn't believe them. And I was right not to believe them because they were wrong. I did the research. And what did it say? It said that you can have Sjogren's without the marker if you have the symptoms, which I did, and which started to get worse because what happened was I was just getting treated for the dry eye, and I was at home watching TV one night, and I couldn't breathe. And I did have I forget what it's called, an oximeter or whatever, a thing that tests your oxygen level. And I left that part out because I have AFib. That's why I had that. And I took it, and my reading was 86. And if you know anything about oxygen levels, it needs to be above 90. Under 90 is dangerous. I took it a couple times, and it was going back and forth. It was the highest it was getting was 90. And at the time, my doctor had gone concierge, and I don't know if everybody listening knows this, but a concierge doctor, you pay them extra besides your insurance, but then they are on call. It's like putting a lawyer on a retainer. So you now have like his cell phone and all this. And so I texted him and I said, my levels are in the 80s. And he couldn't believe it. He said, I can't believe that. I said, well, I'll send you a picture. Well, the meter, it's going back and forth very fast. So you really can't send a picture. So I had to take video. So I had a video of like 1 minute so he could see the fluctuations. And when he saw that, he said, oh, no, that's not good. Go to an ER right now. So I did. And I went to an ER, and it was in the 80s. And they got me back to a stable level after I was there for a couple hours, and they were going to send me home. And my concierge doctor called me, and he said, did they do a CAT scan? And I said, no. And he said, oh, I don't want to interfere with that doctor there. And I said, oh, no, you will interfere. So I called the emergency doctor over. I said, please talk to my doctor. And so he said, we're going to do a CAT scan. So the nurses had been ready to send me home. So I do the CAT scan, and the nurses come back in and they go, you are not going home. You're going to the hospital, and you're going in an ambulance because you have respiratory failure. Your left lung is collapsed. Okay. And your right lung is showing scarring. Now, this is a part of the story that fits in with Sjogren syndrome, because Sjogren syndrome is thought still to mostly be about fluids, your eyes, your nose, your mouth. However, it is an interstitial disease, which means it can go from one organ to another and cause problems. Because think about it. There is some kind of fluid everywhere in your body, isn't there? Think about it. Yeah. And he said to me, any doctor worth his salt can diagnose something without markers being shown. And I love that line, the way he said that, because that's what I had been doing and trying to explain to many specialists, And I also had, and this ties in with the Sjogren's, they kept telling me that I had GERD. Now, probably 80% of the people that would hear this would say, oh, I have GERD, and that's basically having that reflux where you kind of regurgitate a little bit of whatever you ate or whatever, and it causes a problem in your throat usually. Well, it turns out I had pharyngeal, I'm not probably saying it right, pharyngeal GERD, which meant it went all the way up to my larynx, into my voice box. That's pretty high. What I did was they sent me to speech therapy. They did something on my nose. They did some kind of a partial correction, like a rhinoplasty, because they said it was deviated somewhat. And then they put me on some medication. They also put me on Mucinex, right? And then when the ENT doctor they put that long tube, they go up your nose and down your throat. It's such fun. And he did that and he said, you have this enormous lump of mucus that's caught there. And that's what's causing your voice to go and for you not to be able to talk. I would get very like a frog by the end of the day. So I went to speech therapy. They taught me a couple things, voice things, like as if I was a singer, like just say mo, 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 me, ma, 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 like make sounds like certain sounds and don't cough and don't clear your throat. That's extremely hard. Timing is everything because now the rheumatologist talked to my concierge primary and decided to be a little more aggressive with the tests that he did, the blood work that he did. And when I went back to see him, he said, I found the marker. It's in your salivary gland. So I was like, hallelujah. I've been telling them for 20 years. 20 years that I have Sjogren syndrome. So at least finally they found that damn marker that they seem to need to have. All right. So now, meantime, I get breast cancer. And I go in and they tell me it's HER2 positive. It's an aggressive one. And, we think, no, you have to have a mastectomy. I said, okay. And the doctor said, but you know what? There's this one test I didn't get back yet. It was a certain type of mammogram they did in a certain position, laying down, face down. Would you mind waiting a couple more minutes in the waiting room? I said, no, of course. So she called that lab and she got that test and she called me back in. And she said, well, I'm sorry to tell you this, but this view shows that there isn't just one lump, there's two. And it's showing that it's very aggressive. And I said, okay, then I want you to do a double mastectomy. I want you to take both breasts. I don't want to take any chances. That was fine. So I had a double mastectomy and she checked the lymph nodes and I was on medication, but I did not need chemotherapy, which was good. I wouldn't want to have to go through that. So we treated that. And I'm going to say this not because I'm vain, but because it's a very important part of my decision making. I'm going to be 77 years old in October, and I don't look it. Like right now, I have no makeup on. And at that time, I was probably 66. So because I looked good and young, I decided to let them do implants. Okay. So it's vanity. It was vanity. So they did implants. But of course, with me, nothing goes normal he does the implant, and the left one, breast, went completely red, bright red, and it stayed that way. And it's called red breast syndrome, which is not something. Have you ever heard of it? No. And you're studying a lot of unusual medical. Red breast syndrome happens once in a while. They're not sure if the body is allergic to the materials they use for the support, which is from a cow. It's a bovine material. So I always tell people I'm allergic to cows. I can eat them, but I can't have them inside of me. I mean, it's either laugh or cry, and I'd rather laugh. Anyway, he said, okay, it's happened, and then he's seen it go away. And of course, I believed him. He's the doctor. It did not go away. And then the implants did not sit right. So he had to do another surgery to fix that. And then I got an infection. So he had to do a third surgery. So after that, I said to him, take them out, make me look like a 12-year-old boy. I am not going through any more of this. And he laughed, but he said, I agree. And it was so funny because he told me the minute he removed the implants, the redness in my skin went away immediately. So that happened. After that, I had to recover from that. And there was pain from recovering and healing and all of that. No longer needed to wear a bra. It was like the 60s, burn your bra. So I like that part. Because I always used to be adjusting my straps and oh darn, Anyway, I go to my gynecologist next on the list, and I had polyps. Okay. So I have the examination done, and I go to see him the next day, and he said, you don't just have polyps, you have a factory. I've never seen this many polyps in one woman. I mean, really? You can't make this up. So we were sitting there talking about what we could possibly do. And I said, you know what? I went through the change of life. I'm older. I'm not having any babies. Just do a hysterectomy. Get rid of it. I don't need that factory. And then he said, it was very interesting. I'm not surprised by much, but I was surprised by this. He said, I would like to write a paper on you, on the polyps, and send it to Johns Hopkins. And may I send them a sample of your uterus? So my uterus is with Johns Hopkins. I don't know what they found out. I have to look up the paper and see what happened. It just doesn't stop. It's like I didn't have any original body parts. They've either been replaced or removed, truthfully. So that happened. Now, I'm going to keep going because it's amazing. This is why I wrote the book, An Anatomy of an Alien, because I can't believe all these things could happen to one person. So next down the line, my doctor says to me, you have very bad osteoporosis. Fine. And he said, there is a new drug. And It's an injection that you give yourself every night for a year and a half. And it's supposed to build bone. I said, okay. I look it up. It's $6,000 a month. I'll let that sink in. So I did further research and found out, of course, as a foundation, you have to meet certain income shutoffs. I made it by dollars. Thank heaven. So I was able to get that for free. And every night for a year, I gave myself an injection. It was not fun. I had black and blue bruises all the time. I couldn't wait till the year was over. And I had my bone density test. And my doctor called me and he said, I have bad news. Just once, I'd like them to say they have good news. Oh, my heavens. So he said, your bone density test is worse. You're worse than you were before you took this drug. I said, are you kidding me? I said, no. He said, you are what's called final stage, end stage osteoporosis. It is so severe that if you fall, you will break something. In fact, he said, you could just open a jar of something and the bones in your hand could break. And the irony in this is that I took that damn injection for a year. Yeah. So it didn't work. Going on with that injection and Prolia, which I had taken before that, they both have a side effect of they're trying to build bone in your body, but they take sometimes the bone from your teeth. Don't ask me why. It's a crazy thing. But you could look it up. It's true. Well, sure enough, I started to have dental problems. I did send you a picture. Every single one of these teeth, these beautiful teeth, are dental implants because mine deteriorated from the medication that I took for osteoporosis. Yeah. So I just, thank God I'm in a situation where, insurance doesn't pay for that. And my husband, like almost every year, I needed 1 or 2 implants, dental implants, and they're very expensive. I have a Porsche in my mouth with the money that was spent. Crazy. Oh my. And so that happened. And the pandemic came, 2020. And I have a husband that has Parkinson's, and he's stage 3 going to stage 4. And I'm supposed to be his caretaker. And I had been his caretaker for already 10 years. And even through all my illnesses and surgeries and everything, when I would heal, I would go back to that. But he was getting worse and he was needing more things. In fact, he was starting to need things that I really shouldn't be doing, like give him a little push so he could get into bed or stabilizing him. I mean, just things that I was told not to do. He was actually using a walker, things like that. But he couldn't button his shirt, so I would have to button his shirts and just little things like that. And when he'd get into bed at night, he would freeze, and I would have to push his legs into the bed, all these little things. And of course, now the mental part starts too. So you're like, having problems with communication. And I already have the diagnosis of depression and anxiety. So with 2020, with all the lovely things that I had gone through already, medically, and him with the Parkinson's, we made the decision not to leave the home because, they didn't understand when it first came out how you got it. You remember that? They didn't know if it was by touching something or inhaling. They just didn't know. So we stayed home. But making that decision cost me mental health. So yeah. Yeah. So yeah. And I'm still seeing her. So it's 4 years. And I see her every 2 weeks on Zoom. It really helps me a lot. And I had said to her, it seems later in the day, my husband stops talking, communicating. Like he won't answer me and he doesn't bring up anything. And it's really driving me crazy because, as you can see, I'm a talker.
Yeah.
I'm going to take a sip of water. So she said to me, at 4 o'clock, go in your room and write something. I said, I'm not a writer. She said, you don't have to be a writer. Can you use the keyboard? I said, yes. She said, just put down whatever. And once I did that, it turned into my first book, which is Raised by Wolves, Trapped by Demons. Did not expect it. That's what happened. And I did publish it on Amazon. And it's 4 years and it's still selling. So that's good. But I was able to put a lot of both things in there. The abuse and stuff I went through in my early life, and then the odd illnesses that started coming up. So that was sort of, how can I put it? Like just vomiting out a lot of stuff. It was good for me. It was good for me. Oh, I got two more things. Don't go anywhere. I also had in my quest to be diagnosed with Sjogren syndrome, I had a neurologist do a biopsy on my leg and send it out. And it came back that I had small nerve fiber neuropathy. There's another one for the list. And basically, it's worse than having large nerve neuropathy. But the small nerve neuropathy is also associated with Sjogren's. When you go do the research, you find that out. So I don't know what these rheumatologists are reading. They're not up on the medical data that's out there. That's all I could say. So, oh my, I know. So basically, that small fiber neuropathy was causing a lot of pain too in my body. And I want to say that there's a skin relay sensory function in the body, and that has to do with your nerve fibers. So you don't realize it, but the small fibers in the system regulate things like pain, body temperature, heart rate, breathing. I'm not a doctor, But that's important. And I'm glad that I found out about it, you know, because I think that had a little bit to do with my respiratory failure that I suffered also, you know. So for that, there's not really treatment for it. In fact, I was told that 90% of the things that I have wrong cannot be cured. They only can treat the symptoms. Yeah. Yeah. So the thing is, it's just always something. It's like I never go to a doctor's appointment and leave and say, bye, see you in 3 months. It's always the doctor saying, oh, this is a little different. I've never seen this before. Every single time. So I'm used to it because I'm an alien. I tell my husband that I'm an alien. Now, I've had a couple hernias, and the last one I had, after the surgery, the doctor came out and he said, you know, that wasn't just your everyday hernia repair that I did. I said, well, I'm not surprised because it's me, you know. He said what it was is called a Spigilean hernia, which is a rare type of hernia. And it happens when part of your intestines pushes through the tissue that separates your front abdominal muscles. Now, that makes perfect sense with the whole problems I had with my stomach, that something like that could happen. So I had this lump in my lower belly, and that's how I discovered it. And because sometimes you can have it and not have any pain. But if you ignore it, they can cause serious medical issues. Like they can grow larger and block your intestines, or they could cut off your blood supply to your intestines. I'm telling you. Oh, gosh. So the last thing, and then I'm going to wrap it up because it's so much information that even my mind is ready to explode. I just kept all my doctor records and stories, and there's a lot more stuff. And I had said to my friends and my family and my husband a million times, I'm an alien, because I would always have this just a little bit different, you know, never saw this. This is rare, you know. And I'm into metaphysical type spirituality. And I decided to write this last book, The Anatomy of an Alien, and merge it with a theory that has to do with some people believe since 1976 in what's called starseed people, that there is a planet that is more advanced than ours. They have better medical technology. They are able to look at other planets. They're so far ahead of us. And the theory is they looked down at us and said, those people are killing themselves. They're going to ruin their planet. So they sent down these little seeds that got implanted in certain people with the hope that their DNA would make those people better people, if that makes sense. Nothing makes sense in my life, so I believe it's possible. So this book turns out to be a paranormal medical mystery. Because when I did the research on the starseed people, which was first written about in 1976 by Brad Steiger, people can look it up, The Age of Aquarius, they had a lot of the same medical problems that I had. And they had a lot of the same personality traits that I have. So the mystery part of the book is at the end, you find out if I'm a starseed or not. So I don't think people have ever, I don't know, maybe somebody has, but I just am intrigued by that I wrote a paranormal medical mystery and tied my life together.
What do you wish doctors knew about Sjogren's that they don't seem to recognize?
They don't recognize that. That's a good question, because they did not want to recognize it as a disease. They would say it was a disorder. They would say Sjogren syndrome disorder. And about a month ago, the Sjogren's Foundation that researches Sjogren's and does a lot of public relations, etc., got the, I don't know what part of the government had to do this, or the medical agency, but they got it to finally be called a disease. They no longer say disorder, they say disease. You have Sjogren syndrome disease, and that is so important, because when you go to a physician and you have your medical history and it says, you have multiple sclerosis disease, you have whatever disease, Sjogren syndrome disorder, they kind of just fly by that. They don't look at it. It's like saying you have itchy skin.
Yeah.
They don't give it importance. So that to me was a big deal.
You mentioned that Sjogren's had led to pulmonary fibrosis and respiratory failure. How did that unfold?
Well, on my research that I've done after that happened, it said that Sjogren syndrome is a disease that has to do with drying out your body. It starts at your eyes, nose, mouth, throat. What's next? The lungs. So all of your organs have some kind of a fluid, involved. As far as the mucus I was having, saliva is supposed to thin out that mucus so that you don't get all clogged up, right? Because I wasn't making saliva, I have this buildup, this backup of mucus, right? After that, you have your lungs. Well, they need a certain amount of moisture too, your lungs. So they're connected. It's all connected. And if they didn't treat it, your lungs would dry up and harden and you would die. So I was put on oxygen at night. So during the night, I have oxygen. Yeah. And that helps. So that's what we're doing right now.
What is your life like now in terms of managing lung issues and oxygen therapy?
Organized person, and thank heaven, because I also have my husband will have appointments, and I'll have appointments, and I try to have a life outside of just doctor's appointments. So like a calendar on the refrigerator and a notebook next to my computer and the appointment book in my purse, and trying to just take care of everything. And what happens for us is I find meditation is very good. If the day is feeling overwhelming for whatever reason, I might just say to my husband, you want to do a meditation? And that's it. I put the meditation on the phone, get in our recliners for 10, 15 minutes, and it's amazing how much it helps. Because otherwise, we would be so overwhelmed just with daily life, just with, your TV doesn't work, or, the dishwasher broke, and just normal things, it's a lot. And then add in the physical factors, me trying to take care of him. So I have some support here in my community. They have a support group that is called Love in Action. And I used to be very busy helping other people, and now I need the help. So I can call and say, I need a medication and I just don't have the energy left to go get it. And they'll go get that for me. So I do have some resources, let's say, which is great. And I stopped cooking. I said, I can't do it. I just can't do it. So I get wonderful meals delivered to my door, and they're quality meals. So that helps. I try to take care of myself. I put a camera in every room so that I could go get a facial or get my nails done and not worry about him. Because I can check on the camera and make sure he didn't fall and that he's sitting in his chair watching TV.
Are there any treatments or lifestyle changes that helped you the most?
Well, right now I'm in the middle of still going through tests and diagnosis. And the temporary solution right now is that I sleep with the oxygen, level 2. And they made sure that it was one that has a water device, because if I just use a regular one, I get too dry. I'm already dry. So this is like a humidifier, vaporizer. I don't know what you call it, but there's a water thing added to it. And when I have the tests completed by the pulmonologist, he might suggest more things for that. But right, I'm still in the evaluation phase. It's not even officially diagnosed yet. They just know that there's a problem. I shouldn't be in the 80s. I should be in the 90s. So I'm working on it.
Your story includes overcoming childhood abuse. Do you think your past trauma affected how you navigated the medical system?
The first book was it started to be about navigating the childhood and early adulthood, which you realize I had no coping skills because I did not have parents that taught me anything worthwhile. So I had no coping skills. So I had to navigate my young adulthood, which was not done very well. And then when I finally, I did a lot of work, did a lot of psychotherapy and counseling. And I worked on a lot of the things with the child abuse. And it was more mental child abuse than physical. And I found out later from my brother that his was physical. And it came from my mother. She beat him. And she must have did it when nobody was home, because I never knew. But once I navigated, I think, Joanne, this just came to me. I think when I stopped drinking and I got a clear brain and I wasn't deadening and I wasn't, numbing myself, I think that's when I was able to get to the core of everything that had happened the first 40 years. But the physical stuff had already started. That had already been in process because your body is taking all that stress and doing things with it. And I think that going to counseling after getting sober and working on myself, that helped me medically and spiritually. But the physical stuff, it's like started raising its head 20 years ago. So then it really started coming out. Okay, so she's inside, she's getting it together. So now we're going to let it all out, all the effects of it, how it affected her. And this is how it affected her from head to toe, literally. And it could really, and I did think about suicide once or twice when I was going through the emotional, physical, and sexual abuse of my first husband. But I think all this stuff could really put somebody down, like make them want to sit in a chair and not move, because it's a lot. It is a lot, but I have a strong will, and I'm very resilient, and I'm very curious. I don't stop. If I don't like an answer from a doctor, I'm going to go look for another answer or another doctor.
Some people feel that childhood trauma makes doctors take them less seriously. Have you experienced that?
But I'm just trying to get to what the last thing you said was. I told you I'm going through with the pulmonologist, okay, and talking about gaslighting and stuff before.
Many rare disease patients deal with medical gaslighting. Did you ever feel dismissed when talking about your breathing problems?
I went to a pulmonologist when this happened, when I had the problem. And she was talking about the Sjogren syndrome and wanting to know how I knew that I had it. And she wasn't talking about the lungs or the correlation or anything. So after a while, I said to her, I'm here about my lungs and that I had a respiratory failure and that I have scarring on the one lung, and not here to talk about the Sjogrens. You're a pulmonologist. I want to talk about what happened. So she insisted that I get another CAT scan. Now, I just had a CAT scan 2 weeks ago in the hospital. So I called my primary and I said, I'm not going back to her. Give me another one. So he sent me to another pulmonologist. And I was in there and I said something about the Sjogrens. And he went like this. He like sort of brushed me off. He didn't schedule any tests. And then I said to him, well, do you want to see me in 3 months or 3 weeks? Or no, if you have any problems, call me. I thought, oh my God. So I went to a third pulmonologist. You see where I'm going with this. And he walked into the room and he said to me, I see that I'm your third pulmonologist this year. And I said, yes. And would you like to know why? And he said, yes, I would. And I said, well, they failed one of the courses in medical school. And he said, what course was that? And I answered, bedside manner, which he thought was very funny. So he said, well, I hope I'm going to be the last one. I said, oh, you already are. And guess what, Joanne? He scheduled 5 tests. 5. He didn't brush me off. He didn't want to talk about anything but the lungs. And that I appreciate it.
What tests did he schedule?
But what kind did he schedule?
What tests did he schedule?
Oh gosh, I can't name them by heart. One of them I think is called the 6-minute walk, which I know I'm going to fail. There's no way I could walk 6 minutes without like losing breath, you know. And then there's another one where you kind of blow into a tube and they test the strength of your lungs and, you know, things like that. But he ordered the tests and he said, and I want to see you the next day. Now, I think you already know this, but I'm going to say it. You could have the best doctor in the world, but they could have the worst staff in the world, which happens. So this man, I went out to do what he told me to do and schedule with his assistant. And she scheduled and she said, oh, he wants to see you the same day that you're having the test. I can't do that. I don't know what I'm going to do. I said, honey, schedule me for him for the next day. Do the test on Monday. Schedule me on Tuesday. It'll be fine. So the date is coming up and I don't get a call. And I call them and they go, oh, we had to cancel your test. I said, really? I said, well, number one, why didn't you tell me they were canceled? And number two, why were they canceled? And they said to me, we don't have enough staff that day. I mean, medical, you want to talk about the medical profession? That sums it up right there.
What inspired your books, The Anatomy of an Alien and Raised by Wolves, Trapped by Demons?
Like I said, the first book was definitely, it was a memoir, so it was nonfiction, and it was 100% true. The second book, I found out through DNA ancestry that my father, who was adopted, was 100% Irish. And he hated the Irish because England and Ireland at one point were not friendly. And England, and of course you know this, you're from England, correct? I think you're from, yeah. They were taking territories. So I found out that both his parents were from County Mayo. So that book, I went back to the 18th century And I was able to find all the records I needed to prove the ancestry. But I wanted them to have a little background. So I would make up a story. Like I would say that, the guy was a blacksmith or whatever, and he was married to Mary so-and-so, just to have a storyline. Okay. So I call that, it's like a mix. It's everything is true as far as the names, the dates of birth, their children, everything. But what they did for a living, I'm making up. So I tell them that in the prologue. So now that I thought, wow, that's a totally different type of book. That's a historical book and a genealogical book, right? I guess I could write other things. So when this book came up, the alien thing, it was, I just kept telling people every time something would go wrong with me, I'd say, I'm an alien. And they'd laugh. And then I'd say, no, I'm going to write a book. My next book is going to be The Anatomy of an Alien. And they would laugh. And I'd say, no, it's going to have pictures. It's going to have all the strange things that have happened to me. So that was my inspiration. And I looked forward to writing that book a lot. I really enjoyed writing it too.
If someone with a rare disease is struggling to be heard, what is the first step they should take?
First step is to be your own advocate, to not believe things that are said just because they have doctor in front of their name. It's to do your own research. And today it is so easy to go on the internet. And I'm not talking about like the doctors will say, oh, you went to Dr. Google. No, I go to the Mayo Clinic website. I go to the Johns Hopkins website, reputable places. I type in what I want to know, and it'll take me to a medical website that is doing research on that thing. So getting your own information, okay, and being stubborn and not giving up, and that's it. Be your best friend, your best advocate. You know your body. You know your body better than anybody else. I complained about one certain thing for a while to two different doctors. And finally, it came to be believed by them, and the surgery was done. And the one doctor who had read my first book and knew I had a crazy life said to me, you might be a little crazy, but you know your body. And I do. I know my body. So that's my advice there.
Many autoimmune diseases, including Sjogren's, seem to have a connection to inflammation and gut health. Have you found that certain foods make your symptoms better or worse? Have you made any dietary changes since your diagnosis?
with most autoimmune diseases. Yes, there are some foods and things. The worst thing in the world, and something I'm very guilty of, is artificial sweeteners. They are really poison. And from always trying to lose weight, I got into the whole diet soda thing, and in my coffee, the diet sweeteners. So I'm trying to weed myself off. I looked it up, which is the least poisonous of them all, and it came up stevia, because it's a natural plant-based sweetener. So I've been using that, and it's not as sweet as what I'm used to, but I'm doing that. I think it's important. Spicy foods, I was told by the speech therapist, because of what's going on with my body and my throat and everything, to cut them out, because they're going to irritate my throat. Even an acidic thing like orange juice, things like that. Now, I don't drink orange juice, but it's really hard if you do, like I said, with like the saccharin, the equal and all those things. I got to change it. It's not fun. But I do also find there are some foods that are extremely good for you, and I could eat every day. And the two of those foods are salmon and avocados. They are very healthy. They're good for you. And come to my house and you'll always find those things in my refrigerator. And a lot of water. Water is very important.
That brings us to the end of another Reconnection episode. A huge thank you to Mimi for sharing her powerful story and shedding light on the realities of Sjogren's syndrome and medical trauma and resilience. If you enjoyed this episode, please subscribe to my podcast, Reconnection, and my YouTube channel, Rare Chef. If you're watching this video, if you're watching the video version, please let me know your thoughts in the comments below. If you're listening to the audio version, you can reach out by clicking on the send me a text link in the show notes. If you love the, I'd love to hear from you. You can follow you can follow Reconnection on Facebook, X, formerly Twitter, and LinkedIn to stay connected and join the conversation. And before we go, if you are someone is struggling, help is available. You can call or text 988 for immediate support in the U.S. You are not alone, and there's always somebody ready to listen. Thanks for being part of the Reconnection community. Until next time, take care and keep advocating.